Okay, hopefully this will work. Okay, I ended the first video. I'm not sure if people are having trouble joining in, but I'm just gonna go ahead. So my name is Temmy, and this is General Health Talk. So we do this video every third Friday of the month, and occasionally when there is unforeseen circumstances, then we'll have to make adjustments to the schedule. But before I go into today's topic, I'm just gonna do quick housekeeping things. So our monthly nourishment outreach for this month is gonna be in Oyo State, and it's gonna be in these following communities: Gambari, Igbon, Alate, Owode, Tewure, all in Oyo State. So those are the communities that we will be visiting this month for our monthly nourishment. And also the youth empowerment incentive, the deadline for the application of the youth, the third batch of the youth empowerment incentive is gonna be May 31st. So if you know somebody that is gonna benefit from that, or if you need help or you believe you benefit from the program, feel free to go on our website and fill in the application, complete the application, or you go through our Facebook page. There is a link there that will take you directly into the form. So those are the few housekeeping things. So before I dive into today's topic, which is cancer, okay, I'm just gonna do a quick disclaimer right here. This program is not intended to the intention of this program is not to treat or to diagnose anyone. The goal of this program is to educate each other, educate ourselves, and create awareness, so we can stay informed. So like I said, the goal of this program is to create awareness, educate each other, so we'll know what to watch out for. So that said, today's topic is cancer. I'm very sure we all are familiar with what cancer is. If you don't have it, maybe you have a friend, you have a co-worker, you have a family that have been diagnosed with cancer, or they're going through that right now, or somebody that is yet to be diagnosed, but they having this feeling that maybe something is wrong. They might have the condition or something, but they're just scared to go get checked. All right, so my recommendation for everybody that is watching me, including myself, is that we do not take our health for granted. I think we should put a stop, especially my Nigerian people, we should put a stop to self-medication. We need to stop self-medicating ourselves. If you keep having certain persistent signs and symptoms, that should be a sign, a signal that you need to seek help. You need to seek help. If you keep taking medication, self-medicating yourself, and that symptoms it's on and off, it's not going away, you need to seek help. We need to stop self-medicating ourselves. Okay, so what is cancer? So cancer is a collection of various diseases that is characterized by abnormal cell growth. So, and the cancerous cells, they divide and replicate without stopping. So once they're there in the system, they just keep multiplying, they just keep dividing and multiplying without stopping. And then if care is not taken, if there's no early detection, then they're gonna spread all over. They're gonna spread all over to other parts of the body. And we have cancerous cells, we have benign cells. So if it's benign, once they remove it, it's most likely that they don't come back. They don't grow back. But if it's a cancerous cells, there's a probability that they might come back. So I'm just encouraging everybody that we need to take our health serious, that we should always seek help. We need to always seek help. So, and some cancers can be found early, before they have the chance to grow and spread. But how will you know? If you do not pay attention to your body, if you do not seek medical attention, how will you know that is going on in your system? So, this video is actually going to be part 1 and part 2. So we have some of the cancers that are most and often affect women. We have over 200 types of cancer. We have so many types of cancer, because the cancer can happen in any part of the body, and it can happen to anybody regardless of the age. So, but we have some that are more prevalent in women, like the breast cancer, the colon cancer, the endometrial cancer, the lung cancer, the cervical cancer, the skin cancer, the ovarian cancer. All this type of cancers are more prevalent in women. And knowing about these cancers, this type of cancers, the signs and symptoms to watch out for, the do's and don'ts, will help us to prevent them, or find them early. And that may help save lives. So, breast cancer. Breast cancer is the most common cancer that women face in their lifetime. It can occur at any age. But as the older you are, the higher the risk, so the risk increases with age. So as you grow older, your chances or your risk of having breast cancer also will increase. So, and we have different types of testing to detect this type of cancer. It is like mammogram is one of them. So mammogram, it is recommended for people age 45 to 54 to have mammogram done every year, and women age 55 and older can do mammogram every 2 years, or they can do it every year. It depends on the history. People that have family history of breast cancer, they might have to have a mammogram done maybe every 6 months or every year per their doctor's recommendation. So, but if you have family history of cancer, or there's a genetic factor, then you might want to discuss with your doctor, because if you're between the age 40 and 44, they might allow you to do the mammogram. But normally they don't do it for people that are below 45. But if there is any genetic factor or any family history or any underlying medical condition, yes, then the doctor may recommend you to go have mammogram done so they can detect that. And so I'm sorry, I'm just going through my list here. Okay, so we have, like I said, we have tons of different types of cancer, over 200, but we have some that are more common in women, in men, and then like today I'm gonna focus more on women, And even some of this cancer too, we can find it in men. So yes, men too can benefit from today's video. So these are the signs and symptoms that you cannot take for granted. You cannot just take them for granted. You know, if you have lumps or bumps in your breast, or you know, or your nipple get scaly or start flaking, you know, and you don't understand, you don't know why, and you see all those changes on in your breast, and you're still keeping it to yourself, please don't keep it to yourself. Please go consult with your doctor. You know, if you identify any changes in your breast, in the shape, you know, you need to go see a doctor. You know, or if there's any nipple discharge, you know, you need to, and you're not breastfeeding and you're having a discharge from your nipple, then you need to go see a doctor. You need to go see a doctor so they can rule out cancer and find out whatever that is going on with you. If there's any dimpling on of the skin, you know, or your skin look like you know, we all know orange. So you know, the skin of the orange, and your breast skin look like something like that, that's something of a concern. You need to go see your doctor. You need to follow up with your doctor. You know, or there's redness, there's swelling, there's this pain that you cannot just explain what is going on in your breast. Please do go see a doctor. Don't take all the signs for granted. You don't want to take it for granted, because if you're able to detect it early, then, you know, maybe it's curable at that time. But if you wait until it gets too late, then there's nothing anybody can do about it. So we don't have to wait. You know, we just don't have to wait. And also, you know, the colon cancer. Okay. So the colon cancer, the test for the colon cancer is colonoscopy. But colonoscopy is actually recommended for people age 50 and above. But if you have a family history of colon cancer, then you need to discuss with your doctor. You need to discuss with your doctor. You know, it's just so unfortunate that as I was preparing for this talk yesterday, a test came in from a friend that just lost a family member. And they lost a family member. This family member died of colon cancer, you know, and he just found out about this problem maybe less than a month, you know. And I was just like, I was short of words. Like, it was just too fast, just too rapid, you know, because it was just last week that we were discussing about it. And unfortunately yesterday I was told that the guy passed away. You know, men, I know you men don't like to seek medical attention. You guys just don't like to seek medical attention. You don't like to go to the doctor. You like to self-medicate, you know. Your ego, your pride, you won't let go of that, you know. This has nothing to do with ego. Has nothing to do with pride. If you love yourself, you need to be seeking medical attention, you know. You need to be seeking medical attention. I'm pretty sure that person probably didn't pay attention to their system, or they've been experiencing some signs and symptoms, but they just like neglected that and they didn't follow up with the doctor on time. It's just quite unfortunate that it's too late. Now the person passed away. You know, I have friends that have passed away, you know, due to cancer, you know, the breast cancer and all kind of cancer, family members, you know. So this thing is real. We need to take it serious. We just need to take it serious and pay more attention to our system. So I was talking about colon cancer. So if you identify blood in your stool, when you do number 2, when you poo-poo and you look at your poo-poo and you can see blood in it, and you're not on your monthly period, and you cannot explain why there's blood in your stool, please go see a doctor. You just need to go see a doctor so they can do proper testing. Colon cancer is the third most common cancer in women. Breast cancer is the number one, but the colon cancer is the third. If you see any red or dark blood in your stool, you need to see a doctor. If you've been going through constipation back to back, even though you're drinking enough water, but yes, you're still experiencing constipation, diarrhea, people that have irritable bowel disease, yes, they're at risk for this. If you keep experiencing bloating, yes, you might be at risk for this. So please do not take all these signs and symptoms for granted. You need to go see a doctor. They need to check it out and rule out that you're okay. You can't just sit down and fold hands and think all is well. And I'll think, it's just a minor thing, I'll just take medication, or you go and take ampiclos and other. We need to stop self-medicating ourselves. We need to go seek proper medical attention. We just need to, because like colon cancer, if they detect it early, it is more curable, but if it's too late, then there's nothing that can be done to that. Like I said, if you have unexplained weight loss, you keep losing weight and you don't know why you're losing weight, or you don't have appetite, you cannot explain why, all those things, you need to go see the doctor, or you just keep getting tired, you don't know why, or you have 1 or 2, 3 of these symptoms I just mentioned, please go see a doctor. Please don't wait. Please don't wait until it's too late. You need, or if you're overweight. If you're overweight or love to eat high fatty foods, all those things are risk factor for colon cancer. If you are a smoker, yes, if you're not being active, if you're one person that loves to live a sedentary life because of technology, you'd love to sit down in the comfort of your home and then just be on the computer, do everything on the computer. You cannot walk, you cannot run, everywhere you have to go, you just have to get in the car. You're not active at all. Please, let's make changes to others' lifestyle. All these things are risk factor for colon cancer or any of this cancer. And the third one is the endometrial cancer. Okay, so endometrial cancer is the cancer of the lining of the uterus. So, and this can occur, it's more common in women age 55 and older, or if you're taking estrogen without a progesterone, or you've been diagnosed of maybe breast cancer or any cancer and you're on tamoxifen, because tamoxifen is one of the medications for cancer. If you're being on it, that puts you at risk for the endometrial cancer, or people that are women that do not have any children, that like have history of infertility. Yes, that puts you at risk for endometrial cancer. People that started their menstrual period early, yes, you are at risk for endometrial cancer. And people that are experiencing late menopause, they are also at risk for endometrial cancer. So what can you do? All you can do is make sure that you seek medical attention. Make sure you seek medical attention. If you're in your menopause already and all of a sudden you start seeing blood and you cannot explain why you're seeing blood, because you've been in menopause for over 12 months and now you're seeing blood, you need to go see doctor. Or you're sporting, or or you start having your menstrual period again, after a whole year of menopause. You need to go see doctor. Something must be going on in your system. And how can you find out? The only way you can find out is seek help. You need to seek help. And It's always good to do pap smear. Yes. If you're sexually active, you need to be doing pap smear every 2 years, every 3 years, per your doctor's recommendation. You just need to, because by doing that particular test, they might be able to identify this cancer early. There might be a signal from that test, and then, like I said, it's always, what you can do is always seek medical attention. Don't just sit home. I know in Nigeria, most of those things are stigma. We don't want to discuss it. We don't want people to laugh at us. We don't want people to know we have history, this type of history in our family. Who cares? Who cares? People, you're hiding it. Why don't you just open up? Why don't you just talk? Open up. Maybe somebody out there might help you. Seek help. Forget about people laughing at you, or people that will think that you have this type of condition in your household. Who cares? Forget about those people. Seek help. This is about you, not them. Because they don't know what is going on in their own family, so all they do is just pay attention to your family. Disregard those people. Go seek help. It's all about you. It's all about your help, your health. So whoever that wants to laugh, let them laugh. Whoever that wants to turn your story into their own personal headache, you can't help them. Let them satisfy themselves. But the most important thing is for you to seek help. Go out there, seek help. Talk to somebody that might have knowledge of what you're experiencing, or go confide in your doctor. Go confide in your doctor. If you have a friend that you can confide in, do that. But do not keep it to yourself. Don't keep it to yourself. So another one is lung cancer. So yeah, well, when I mention lung cancer, I know a lot of people think, well, I don't smoke, so I there's no way I will get lung cancer, or there's no way I'll be at risk for lung cancer. Lung cancer is not only for people that smoke or that smokes. No, even if you are a secondhand smoker, you are at risk for this. And there's other underlying causes. So, but the only thing is you need to seek help. If you have that cough, or the hoarseness that will not go away. I know, like over here we have flu season, that people cough, people have runny nose and all this stuff, all this allergy thing. But if you are coughing and it's not going away, even though you've used everything, it's persistent, then you need to seek medical attention. You just need to seek medical attention. Don't wait until it's too late. Don't wait until it's too late. People that if you are a smoker, yes, you are at risk. Yes, I know people say, well, my father smoked for 100 years and was never diagnosed of lung cancer, so I don't think I will have it. That's your father. It's not you. Don't forget that our forefathers, our fathers, they didn't eat all those junks that we young people nowadays do eat. So, and our immune system varies, so you cannot compare your father to you. This is an individual thing, even though family history matters, but it's individual too. So don't base it on my father smoked for 100 years but was never diagnosed of lung cancer, so I'm fine, I'm okay. Seek help. Seek help. If you are a girlfriend to a smoker, indirectly you are a smoker too, because you are a secondhand smoker. You're inhaling all the smoke from the cigarette, so that puts you at risk for that. And I'm just gonna say, I do have a patient right now that she was never a smoker, and then but her husband was, and through that she became affected with that, and now she's suffering from a chronic or severe COPD. Even she She have lost one kidney, and the other kidney, it's not good either. So, you know, and all this from being a secondhand smoker. So please don't say, oh my God, and all these ladies out there that you think you're doing big girl. If you don't smoke, then you are not a big girl. You're only killing yourself. You're just only killing yourself. So please, if you're a smoker, try to quit. I know it's not easy, but yes, you can. If you're somebody that love to smoke one pack a day, you can reduce it to maybe 10 sticks. You know, you can reduce it gradually. So, but seek help. You know, just always seek help. And another one is the cervical cancer. Okay, so, and cervical cancer can affect any woman who is or has been sexually active. If you have history of human papilloma virus, HPV, yes, you are at risk for cervical cancer. If you're a smoker, like I said, if you have HIV, AIDS, or have poor nutrition, or you do not do a regular pap test, you are at risk. Because when you do your pap test, when you stay on top of that, yeah, there's probability that they might pick up a signal from your test, from your pap test. So again, I cannot emphasize this enough that we need to seek help. We just need to seek help. You say cervical cancer testing should start at age 21. So women under 21 should not be tested for cervical cancer. But from between 21 and 29, yes, you should have pap smear done every 3 years. That's the recommendation. That if you're between 21 and 29, you should have pap smear done every 3 years. If you're sexually active, because now, oh my God, the world is upside down. So even a 15-year-old is no longer a virgin. So yeah, if you know you're sexually active, yeah, you might want to go get that done, you know. But the recommendation is for between 21 and 29 to get pap smear done every 3 years. And they should also test you for HPV, human papilloma virus. So you might want to have that done. If you're between age 30 and 65, then the test should be done every 5 years with HPV tests. So, but if you still want to be doing it every 3 years, that's okay, you know. But if you're over 65 years and, you know, and your results have been positive for the last 10 years, then there's no need to continue doing the test. So, and if you know, because we have some women that have history of hysterectomy meaning they've had their uterus and cervix removed for a reason. It might not be a reason not related to cancer, but yes, they've had that removed. So, you know, they should not do this test. They should not do pap smear. There's no need for that, you know. Then because there's nothing, then you're not at risk for the cervical cancer. But if you have history of cervical cancer, then you may want to go ahead and have the test done. Okay, so another one is the skin cancer. Okay, so if you spend a lot of time in the sun, then you are high risk for skin cancer. All our mothers that do have shops in the sun, all these are construction workers and all the stuff, the police, the traffic, all the people and all that, yes, they are at risk for skin cancer, especially if you are light skin. You know, dark skin people, yeah, at least they're okay, they're saved, but to an extent. But if you're light skin, then you're at risk for skin cancer, especially those with blonde hair or red hair. Yeah, you're more likely to get skin cancer than people that are darker in color. So If you have, or if you had any family member with melanoma, and they've had bats like sunburn as children, they're more likely to get skin cancer. So and what can you do? You can always, when you're going out there in the sun, you can always use any lotion that has what is this called, UV ray protection, you know, SPF, like the broad spectrum sunscreen, SPF 30, 15, you know, we have 15, we have 5, we have 30, 10. So it's always good that you use any lotion that has SPF in it, you know, at least that will protect your skin from when you're in the sun, you know. Okay, so all right, so with the skin cancer, you have to be aware of how moles or spots on your skin. You know, if you identify any changes on your skin, and that you cannot explain, you need to follow up with a doctor. You just need to follow up with a doctor. So the next one is the ovarian cancer. Ovarian cancer is more likely to occur as women get older. You know, so if you have never had any children, if you are experiencing infertility, or you had your first child after 30 years, that would be me. So yes, I fall under that category. We might be at risk for the ovarian cancer. So if you have if you're experiencing infertility, if you ever had any child or any children, if you have had your first child after age 30, yes, that puts you at risk for ovarian cancer. Women that have used estrogen, you know, alone as an hormone replacement therapy, yeah, they're also at risk for ovarian cancer. If you have family history of ovarian cancer, yeah, you need to pay attention to your body. You just need to pay attention to your system, you know. And even if you're not experiencing any of these things, no family history, you have children before the age of 30, you're fertile, you know, you can still get ovarian cancer. So the bottom line is, pay attention to your system. Like I said before, always do a pap smear every 2 years, every 3 years, you know. It doesn't hurt. It does not hurt, you know. All that money that you spend on makeup, or to Tigely to go to somebody's party every weekend, you know, you can actually skip maybe 2 weekends, you know, save the money and go get checked. Just go get checked. You know, you'll be saving yourself, you'll be doing yourself a good if you are on top of your health. And you know, Nigerians will believe in, oh, you know, it's because I fought with so person last week or last night, and you know, and maybe that's the person that afflicted me with these diseases or something, is never in our family. And come on, please, come on, go get checked. I cannot emphasize this enough. Just go get checked. And before you start using herbal is good, but you need to know what you're treating first. So go get checked. And then before you start treating yourself, you need to stop medication. We just need to stop that. We need to stop the self-medication thing, you know. So if you see if you're experiencing any of these, like if you have abdominal swelling, if you have problem with constipation, if you are lost appetite, if you're experiencing bloating, abdominal pain, pelvic pain, you feel like you need to pee pee all the time, you cannot hold your urine and you don't know why, you're not on a water pill, you're not on diuretics, you're not on water pill, but you keep peeing all the time, you don't know why, you need to go seek help. You just need to go seek help. If they can do a pelvic exam, that should be part of a preventive service for women. So we need to go get checked. Men, women, we need to. Like I mentioned before, cancer can happen at any age. It can happen in any part of our body. It's always good to pay attention to your body, know what is going on in your body, know each part of your body, know how, like, what your breast look like, what your down there look like. You need to. So because if you do, you'll be able to identify any problem easily. But if you don't pay attention to your system, you just think it's a common cold, or it's just, because I drank a lot of water, or because something, you just keep giving excuses for what is going on with you. It might be too late. It might just be too late. So we need to seek help. If you have a long-lasting sore throat that will not go away, you don't know, maybe that's a sign of a throat cancer or laryngeal cancer. You don't know. If you keep going to, like, you have diarrhea, you have abdominal pain, you don't know, maybe that's a sign of colon cancer or stomach cancer. You don't know unless you go find out, unless you seek help. If you keep losing weight unintentionally, it's not that you want to lose weight, but for some reason you just keep losing weight and you cannot explain it, you need to go see the doctor. Or all of a sudden you just lost appetite, all those things that you enjoy eating, now you just don't even have appetite and you can't explain it. Please go see the doctor. Go see the doctor. If you have difficulties swallowing, that may be another sign of a throat cancer. You need to see the doctor. If you keep bleeding, you cannot explain why, like I said before, you're able to see blood, or you see blood in your stool, you need to go see doctor. Or you keep coughing up blood, that could be a sign of lung cancer. We all need to seek help. Fatigue without, not that you've been walking and all that, but you just don't have energy. You need to seek help. You need to seek help. And if you keep having this body pain, that you cannot explain, maybe that's a pain from the bone, maybe that's a sign of leukemia. You don't know unless you get help, unless you get checked. So please let us pay attention to all these signs. Jaundice, jaundice is mostly common in children, infants, babies. But if you as an adult have jaundice, then you need to go get checked. Maybe something is wrong with your liver. It might not be liver cancer, it might not be cancer, but maybe something is wrong with your liver. That's not normal. So we need to get checked. Like I said, lower back pain, pelvic pain, you need to get checked. So overall, let's take control of our health. We can all reduce the risk of cancer. If you're a smoker, stay away from cigarettes. Just stay. I know it's very, very difficult to quit. That's one thing. Even if you're an alcoholic, it's more easier to quit alcohol than cigarettes. Yes, it's very, very difficult, but you can do it. If you love yourself, you can do it. You can do it. We need to stay healthy, pay attention to our weight. Say, I just want to lose 15 pounds and I'm working on it. It's not easy, but yes, I am working on it, Let us stay active, eat healthy, plenty of fruits and vegetables, stay away from red meat, limit amount of alcohol that you drink. Protect your skin when you go out there. Like I said, try to use the lotion that have SPF in it, at least SPF 30. That's a good one. So know yourself, know your family history. You know, Niger people are big, eh? Forget that something is a stigma. It's your life, okay? It's your life. Go seek help. Go get checked. Forget about somebody is going to think, oh my God, I don't want my husband to know that we have this thing going on in our family. Oh, I don't want my wife to think, oh, we are sick in our family. Please get out of that zone. Go get checked. Men, my men out there, I need you guys to stay on top of your health. You guys are always in denial. You're always in denial. You don't like to go to the doctor. You don't like to get checked until you cannot do no more, until it's too late. You know, until it's too late. Please, men, go get checked. Put the pride apart. Put the ego apart. Okay? Don't stop self-medicating yourself, using antibiotics for everything, using Panadol for everything. Stop cajoling, you know, cajole everything. Stop going to the nearby chemist. Go seek proper medical attention. You know, men, you know, I have one in my house. I have a brother, you know, I have friends. I know you guys don't like to go to the doctor, you know, but don't wait until it's too late. Just don't wait until it's too late. Like I said before, this is part 1 of the cancer. Next, on the next video, we will be doing part 2. I will be talking about the cancers that are more prevalent in men on my next video. That will be in 3 weeks, every 3rd Friday of the month. So thank you, everybody. Stay blessed, stay on top of your health. You know, health is wealth. No amount of money that you have will make any sense if you do not stay on top of your health. And if somebody is going through something, please don't be that one person that will be laughing at that person. Please do not. If you cannot support them, because at that particular time, at that difficult time, all they need from people around them is support. But if you cannot be that person that will give support to the person going through difficult times, just stay away from them. Stay away from them, because they do not need your stupidity. They do not need you to add to their sorrow. And like I said, having a family history, going through something, it's not a stigma. Care about yourself. Pay attention to you. Forget about what people will say about you. It's not all about people. It's about you. So please, I'm also guilty. Yes, yes, it's very easy for me to sit down here and start talking. Yes, but I'm guilty too. So we can all learn from this. We can help prevent cancer. We can all put a stop to it. Like I said before, unfortunately, researches are still going on this cancer to find a cure to it. But at this time, unfortunately, prevention is the cure. You know, prevention is the cure. So please share this video with family, with friends, and join me next month on the part 2 of cancer. Thank you, everybody. Stay blessed. Bye.